Are you tired of hearing about mental health from a superficial view and want to hear about realistic views? Well, you've come to the right place. A space where healing is central but also normalized. Join hosts Danica and Myra as we engage in topics around mental health and keep it real while also giving you the work. Welcome to Black Women Healing Podcast. All right, y'all, we're back with another episode of Black Women Healing Podcast. And as usual, I want to kick us off with a discussion question. So in this question, I'm sure y'all have seen the uproar of Black women in their bonnets at the airport and wearing their pajamas and wearing their house slippers, whatever. So I want to talk about that. I want to talk about what are y'all's thoughts about wearing your bonnet in public and what it means to you. So Danica, I want to kick it off with you. What are your free thoughts about this whole uproar?
I heard a little bit, but I've been trying to okay, whatever. But so I mean, my grandmother did not play and still does not play about you better not come out the house in a scarf, bonnet, or any of that. So that's just how I was brought up, like being from, I mean, maybe geographically too. I mean, I'm from Kentucky. I don't know if that has something to do with it too, but my grandmother, you better not, don't come out in no no housewear, no pajamas, no slip, no. You put on clothes. You maybe you don't have to put on Sunday's best, but you're not. I was taught don't go out in a bonnet or scarf. Have I before? I went out in a scarf before. Would my granny be disappointed? Probably, but she wasn't there. So I think it's people's personal individual choice. Obviously, if that's what you feel comfortable with, that's okay. It's kind of like, I don't know, it kind of reminds me of like somebody just wearing a hat, or sometimes we use certain head wraps and stuff. So it's like, what's that different from it? So I don't think I'll be doing it just because it's ingrained in me so much, but I don't got no problem with it. What about you?
I don't know. Because I was thinking about it and I was like, my grandma would be pissed off if she found out I was leaving the house like that. Because my grandma was very much like, on Sundays, we do our hair, we paint our nails, we lay out our clothes. My grandma's always been very prim and proper because that's how her parents taught her to be. But best believe if I put money into my hair, I'm putting on a bonnet on the airplane and I'm putting on a scarf. But then I paused and I thought about the experiences that Black people have had in this pandemic. We've not only had to fight against racism, but we've also had to fight against COVID. We've had to fight against losing people that are important for us. And this uproar in the news has affected us of what's been going on in the world. Why can't we relax? Why do we have to be worried about bonnets, what we're wearing and things like that? And so I was doing some reading of some of my favorite people on Twitter, and they were also talking about it. Because I was like, I know other people have to be thinking this. Like, why can we have some sense of relaxation? And not to say that it has to be that, but for some Black women, that has been that. We don't want to be worried about what we're wearing or how we're presenting when all these other things are going on. That's not in the forefront of my mind. So then it made me think about, have I left out the house with my bonnet or my scarf? Yeah. Is that at the front of my mind? No. I got other things going on. So I don't want to be policing other people. I don't want nobody policing me. So that's ultimately what I've came down to. I don't care what other people do. Nobody should be caring what I'm doing. So that's just been my piece about it. But I'm curious what you're thinking, Omolara.
Well, I mean, first of all, I will say that I'm just amazed like how slow I guess the news is in terms of that this is like risen to the top.
Right.
So that's the first thing, I guess. And the second thing that I think, right, I definitely feel the same way about how I think you mentioned your mother, grandmothers, all of that. I definitely feel like I definitely have that same kind of upbringing, but I do think that I've gone out with my scarf. I definitely on the plane wear a headscarf when I'm about to nap. That's like a no-brainer. That just has to happen. But I just feel like why I just don't understand why are we paying attention to this when we got so many things that need to be done about our people, and like it's just the media can just be so trifling. That's basically my synopsis. I don't actually care. Wear your bonnet, do what you need to do. you survived to 2021, kudos, do you.
Yeah.
That's what I think.
Yes. Thank you for that. Yes.
So everybody, we're all in agreement of like, do you?
Mm-hmm.
It's fine. And I do like the fact that you all both brought up, like, we have so much more things to worry about. Like, we're literally just trying to survive out here as Black bodies. Like, come on, like, chill. So that was a good little question. So go ahead and get started. I am going to read Dr. Omolara's bio. So Dr. Omolara is a board certified pediatrician for over 15 years and an academic faculty for over a decade, mentoring women physicians of color. She is CEO and founder of Melanin Medicine and Motherhood, a company designed to provide Black women physicians with support through an online community, networking, masterclass events, courses, and coaching. As a life and career strategist, she provides Black women with culturally informed strategies and systems to reduce burnout, achieve personal and professional fulfillment, rediscover their purpose, and finally achieve their vision for life without struggle or sacrifice. Her career has been defined by a passion for social justice, an advocate, a professor, and researcher committed to ensuring that all women and children have an equal right to thrive. She has worked as a global physician across sub Saharan Africa, Asia, and the Caribbean. In that capacity, she is the CEO of Strong Children Wellness and an innovative family practice that addresses both unmet health and social needs for families in New York. Dr. Uwe Medimo, I'm sorry, so sorry, is an expert in the topics of medical racism, addressing equity for women physicians in healthcare, and eliminating health inequities for marginalized children and families. Her work has been featured in several media outlets, including People.com, NBC News, Medscape, Essence.com, Newsweek, Cranes, Politico, Reuters, and NPR. So let's welcome Dr. Omolara. And I just want to say this bio is bomb. I had to read the whole thing because our sis is out here doing it. But so welcome to our podcast.
Thank you so much. I'm super excited. And I'm just grateful for the opportunity to be able to talk to you guys and your audience.
Absolutely. So today you all will be talking about protecting Black women in medicine. And so to kick it off, I'm going to ask Dr. Omolara, what are the challenges that Black women have to deal with in the healthcare system?
Yeah, so we only have a certain amount of time, so I'm gonna try and make sure that I stay within, but it's so much. And I think the way that I like to think about it is that in the healthcare system, as you know, I think most of us don't have the opportunity sometimes to play the role, to be in the role of patient and provider. And I think those are two spaces that both of them have challenges and issues. So starting with when women are coming into the healthcare setting, Black women in particular, I would say there's three places of the need for change and the challenges. I think one has been just thinking societally about our health and the issues that lead to higher levels of high blood pressure, diabetes. It's really, I think sometimes we get labeled as, oh, we have higher levels of this or higher prevalence of this, when actually it's disproportionate poverty that's due to systemic racism in terms of where we live, our housing deprivation, the more of us being unable to buy, the wealth gap, and the housing segregation. And that leads us to issues like higher levels of asthma and food deserts, where we can't find food that actually is healthy for us, and the issues of obesity. And so I think that one, it's the racism that we deal with from a structural level that gives us higher prevalence of these medical conditions. But in addition, the problems with accessing and utilizing healthcare that looks like us, that is like able to respond to us, where we have more physicians and more healthcare providers that understand our cultural experience. I think that's an issue as well as the fact that oftentimes many of the areas where we live and work are health deserts as well. Like, you have to take this many trains or drive here to get to get high quality healthcare. But the biggest thing that I think that we've heard most in the news has been around the fact that oftentimes at the bedside, even if we were able to like overcome the structural issues or the access issues, when we get to the bedside, it's been shown that Black patients actually oftentimes feel like they're less listened to, they're not valued, they're not involved in shared decision making, and a lot of times they're just talked at. And often that leaves a difficulty of people being able to share what's really going on. And a lot of times it's misdiagnosis and lack of the correct treatment, which we've seen the outcomes of.
Yeah. This makes you want to ask if there are any preventative factors that Black women can be made aware of to support themselves as they're utilizing the healthcare system. I had to write this question because I'm thinking about like my search for a Black doctor and not being able to find one. And then being able to find one that they say is in my insurance, and I call and they're like, actually, we're not within your insurance. So I kind of want to ask this question selfishly for myself, but then also for the audience.
Yeah. So first I'm going to give a shout out to Ashley Wisdom, who is a friend of mine now, and she has an app called Health in Her Hue. And so if you don't know about Health in Her Hue, HUE, you should look that up because she's been assembling, and there's a lot that are coming up. Black Women Physicians Directory. I think Dr. Joy from, I forget the podcast,
Therapy for Black girls.
Thank you. She's created something for therapy. So I think that there are different spaces, but Health in Her Hue has been greatly, I think, enlarging in terms of being able to have a lot of providers sign up for that. And not just physicians, but all sorts, doulas, nurses, healthcare, all sorts. And the idea was getting a national directory where we would be able to basically overcome that challenge that you're talking about. I think the other piece of it is recognizing what do we do in the spaces of healthcare encounters. So number one, I think it's really important to know who your team is that's taking care of you, right? So whether that be in the outpatient setting, where if you go to an academic hospital per se, you might have somebody who's still in training and somebody who is, the attending. And it's often important for us to make that distinction and ask if they haven't introduced themselves as such to really know who's the decision-making person who's coming into your rooms. We also, if you're in hospitals, a lot of times there's a huge team. You have nurses, you have medical assistants. And one of the things that I recommend for some of my patients is to bring in a book where people can literally just write who they are on their team and their name. And so you get a good idea of knowing what's happening, because when you're in a healthcare encounter, you're really not focused. You're trying to make sure that you're keeping track of yourself. The second thing I would say is also writing down your questions before you get to the doctor. I don't know what it is. I don't know if you get white coat struck or whatever, but as soon as you enter the doctor's, you had a lot of questions for the last month. And then as soon as you enter, okay, so what these questions do you have? And my patient's like, I don't, I know you have some questions. So writing down and keeping something, whether it be on your phone, just taking a memo, whatever that is, when something comes up, just having those questions at hand for you. So the doctor can do their job, which is, they're working for you pretty much. They're trying to do that. And then one of the other things I usually will say is ensure that you don't have to make any decisions if you don't want to at that time. Remember that if some of us, I think we come from communities and families where the decision making around something might need a spiritual advisor, maybe an elder in your family. And it's okay to say, okay, can I sit with this and then get back to you? It's okay to do that. In an emergency situation, it's probably not okay to do that. But one of the things you need to ask in emergencies is ask for something we call informed consent. And a lot of doctors sometimes, due to just how quickly things run, a lot of them sometimes don't go through it. And so the 4 questions that should be a part of your informed consent that they should be asking you, or that you can ask, right, are what are the benefits of this treatment, diet, whatever it is? what are the harms of it? Like, what are going to be the side effects or the bad things that could happen? What is the impact? How is it going to change the course of like what's going on with me right now? And the last thing is, what happens if I do nothing? And so those are really important to jot down, especially if you're debating on an actual decision around like a treatment or anything like, or medication.
Yes, thank you for that. This is good, y'all. I
I
hope y'all are
know.
taking notes. I'm over here taking all these notes. Like, this is so important. And, I've shared with the audience that I am expecting, and I'm kind of scared because I'm a Black woman. And last year, especially, I was hearing about all these Black women dying during birth. And now that I'm pregnant, I'm like kind of scared. And so, like I told you, like the search for like even a Black PCP, now I'm looking for an obstetrician. I'm like searching high and low and I can't seem to find one. So now I'm even more scared. So I'm curious about ways that I can feel supported and some key people I should probably have on my team for this transition in my life.
Yeah. So I think first and foremost, take a breath. Calm down. Take a breath. Baby needs oxygen. So so congratulations, first of all. And I think the biggest thing is that it is scary. It is scary to see those numbers, but I think you've overcome the first thing, which is recognizing that I need people behind me. I need like, and that's for every pregnancy, because you're alone doing so much work, just as like trying to keep this baby growing, right? And so I think a few of the things is identifying who is going to be your just regular support system. Who are the people who are helping you out? And a lot of us have really lean support systems, a lot of times because we haven't asked for help, honestly. And a lot of us, feel like we're burdening. So I think one is recognizing pregnancy can be a stressful time, and really being able to take advantage of whoever is showing up and asking people for help is important. I think in terms of the actual like pregnancy, there's been a lot of data about just having an extended care team, which includes a doula, and sometimes for some women, if their pregnancy has been not, what we like to say is non-eventful, meaning it hasn't been a high-risk pregnancy, a lot of us really are moving towards midwives and thinking about other opportunities and places that you can give birth to that allow for you, that aren't anxiety provoking for you. I gave birth to both of my babies in a hospital, but that's because it was more anxiety provoking for me to like not be in the hospital. And when you're a doctor and you've done residency in the hospital is actually like, oh, it's a safe space because you spent so much of your life there. But so I think each of us have to make that decision about what is the best environment for us that helps us to feel just feel more relaxed. And then also thinking about, I didn't have a doula, but given everything that we see about how amazing they are, I was like, I wish I did have a doula. And I do think that the other piece of thinking about your pregnancy is also just staying informed. I think that, whatever is the best way that you like to consume information, particularly around, what are the things that you want to ask, what are the questions you're having. Many of us, like you said, when we don't have doctors who look like us, we kind of fear asking questions or just don't feel as comfortable, and we think certain questions are dumb or we're going to be judged. And I think you have to, in order to be safe, you have to say, look, I'm asking the questions that I need. And then you use apps like Health in Her Hue to find physicians that you feel comfortable with, that you can disclose as much as possible, because that's really important for your physician.
Thank you for that. Now I feel a little bit more at ease, because I was like, and it's crazy how things work, because once we like scheduled, I was like, this is perfect timing. I'm asking about this and I know she better have an answer for me. So that feels really good. Yeah.
Yes, this is so informative, and it's making me think about like why we don't get this information a lot, like why it's not as easily accessible, right? So like I could probably go and talk to my mom right now, and she probably wouldn't think, and she probably doesn't do these things, and like that's scary actually.
Yeah, I mean, I would say that I have a chronic illness, an autoimmune disorder called multiple sclerosis, and I think that two things happened. One, having my babies, and number two, then having a chronic illness. And both of those put me into situations where you had to now move into that other space, right, of being the patient. And then when you sit there, you're like, wow, this system is really messed up. And and then you start to kind of internalize and see, well, what are the things that even as someone who is actually well informed about the healthcare system and everything, and I'm still jumping through hoops, what are the things that people like me have to do in order to like get to that place where at least they're able to feel safe? And I think it was just like being able to do that reflection and look back and say, okay, I think people should do this, people should do this, and then being able to share that kind of information. But once again, right, the reason for how I can say these things is because I'm a Black woman who was a patient, right? And so being able to have that experience is why it's so important for Black women to be in those roles. Right now, only 2% of all physicians in the US are Black women. And so, that's why it's hard to find us because there aren't that many of us, right? But two, a lot of times we're concentrated in a lot of the cities and other spaces. So it is really difficult. But I do think, like you said, I do think that there's an important space where we have to recognize, right, that we're all the same. Kind of when we think about police encounters, no one knows if you a doctor. No one's asking you this, like, you're Black. And the same thing for me coming into a healthcare system. I'm first seen as a Black woman, and how do I protect myself when I know these are spaces that have not been kind to us and have not really like valued how we, and have just pretty much dismissed and disrespected and devalued us oftentimes. So
yeah, and I'm just thinking about this. This is kind of a little bit unrelated, but with like COVID, right? And the vaccinations, and our healthcare just kind of going through transitions for a lot of us. What have been your thoughts on like just like the different concerns or issues that may come up? Or I don't know if you know, this is just something I'm thinking about. I don't know if it makes sense.
No, it does really make sense. I think one of the big issues for me around COVID, right? We know that right now the numbers have really shown, before they used to be almost 3 to 4 times in terms of deaths of black people in comparison to white people who had COVID. And I think what we're seeing now is about twice as much, which is still problematic. And I think that I think COVID it came at a point where it was very dramatic in terms of what was happening. Black people were just dying and dying and dying, Black and brown people. And I think now it has pushed many of us, right, to say, this is not just something that is, bad, but this is something that is really taking our lives at a huge pace. And so we have to come out of the forefront. A lot of physicians, many of us are kind of conservative, we're kind of type A, we're kind of like, don't ruffle any feathers, like, just make it through medical school, we're good, okay. But many of us have now become very outspoken. One of the initiatives that I've been working on is with 6 other Black women physicians, is called the Coalition to Advance Anti-Racism in Medicine. And our goal really was prompted by a name that you may not know, Dr. Susan Moore. And Dr. Susan Moore was a physician in Indiana who was caring for people right on the front lines, and then ended up being diagnosed with COVID, and actually created a video of her on Facebook as she was in the hospital, and stated that she wasn't getting the pain medicine, stated that they weren't diagnosing her, they were going to send her home, but she had to use her medical knowledge to prompt them to give her the right diagnosis, and had florid pneumonia, and only got 2 of the doses that she needed for the medicine for COVID. And she ultimately, about 3 weeks later, ended up in the ICU and passed away, leaving her son. And so it really prompted a fire in our belly about the fact that we are unsafe. Black physicians who speak out, there's 2 who are in our cohort who actually were fired from their positions and were let go. And so the retaliation is real when we're speaking out about these things, and hospitals where, like Dr. Susan Moore died, aren't being held accountable. And so this requires not only the demand from all of us in our personal individual encounters, but also the work we're doing around legislation and really protecting and having things in place and laws that will protect both providers and patients who are Black and Brown from these kind of issues, and make sure that these institutions are held accountable.
Wow.
Thank you for touching on her, because I feel like a lot of people didn't know that this happened. And I remember reading about it, seeing the videos, and I feel like nobody was really talking about it. I'm like, how are people not seeing this? Like, this needs to be known that this happened. And
yeah, they're talking about bonnets instead.
Exactly.
Right? Exactly.
Oh my goodness. Wow. Yeah, thanks for bringing that up. And I mean, it kind of goes into our next question, which is, you as a doctor, have you noticed other healthcare professionals treating you differently once they find out that you're in the profession?
Oh, of course. Yes. So, and of course, and it's like, I don't do it right away because I'm just trying to trying to be okay. Okay, you're doing this, but you can see when people aren't completely explaining things, or people aren't, sharing things, or people, and then you can also see the other side where you have some doctors who are doing it right, and who are and that's good to see. But there's a complete shift if once they find out I'm a physician. It's kind of and I know it because we've done it too, where it's like, that's a physician, or that's the daughter of a physician, or so they know. And I think that's one of the pieces that I didn't mention in terms of protecting yourself is, one, if you do have a PCP who you really value and trust, letting them know if you're hospitalized, letting them know that you're there. You need I don't want to say it's someone to protect you, but I might just say that you need someone who they know is watching kind of what is going on. So if it's a nurse in your family, if it's whatever it is, if it's, whoever, just making sure that they're there to be able to, talk to the medical team. And just really, it doesn't even have to be, they have to be a specific expert. It's just someone to advocate for you. And also know that there are people in the system called patient advocates when you're hospitalized that you can talk to if you're having issues with your medical team. What I will say is that a lot of them haven't been really trained in the space of talking through medical racism and making sure that medical racism is acknowledged. And so that was the issue with Susan Moore. She did call on a patient advocate, and they kind of were like, we don't know how to handle your claims per se. And so she had to actually use her degree to get up to the chief medical officer, which many of us can't do.
Wow. Oh my goodness. Wow. It's so much. With all this information that you hear and see, and I can hear that you all are doing the work, that you're doing the work, and I think it's beautiful. But sometimes it can become overwhelming. So I'm wondering, personally, how do you take care of yourself?
Yes. So this is funny. So actually, I think my daughters have really helped so much with that. They know in the work that I do in melanin and medicine that my goal is to make sure physician women are taking care of themselves, and they'll hold my feet to the fire if I'm not doing the same. So they honestly, even now, I had to reschedule everything for the summer. So no Saturdays. I can't work. So Saturdays and Sundays are free now. And I think that it's really just making sure, for me, understanding, I think each of us needs to understand what it is. How do we get our energy? I'm an introvert, so I like after something like this, I need to go into a hole, read a book, go to sleep, because I know things like that drain my energy. But some people are really energized by having people around them. So identifying what it is for you and looking back at your week and saying, oh, this is when I felt most alive, and starting to like capture that. So for me, it definitely is reading. I'm a big nerd. So it's like reading. I love like also like Real Housewives, anything like I will watch. And that's very helpful for me. But really, and going out with my kids and just playing with them, and just like taking the breaks that I need. So I think it is important. We have work to do, but this is a marathon. Like this work is, they are fighting tooth and nail, like to not, like they see how our country is diversifying, and they're fighting tooth and nail not to let us have that power. So we have to conserve our energy, tap out, give a baton to someone else while we're tapped out, regain our energy, then go back in. And I think that's the way that we can all work together to do this work.
Yeah, I really loved having you say you have to come back. But before you leave, we always ask our guests if they have any takeaways for our listeners. So that could literally be anything that stands out for you that you feel is important for our listeners to know.
Yeah, so it's funny because I do a workshop called Pivot to Your Purpose, and one of the first exercises that we do is called Hills and Valleys. And so the reason why we do it is because a lot of us are not recognizing. I think it really segues from what you talked about, but not recognizing our resilience strategies and how we can take care of ourselves. So one of the things I have people do is if they make have a piece of paper and draw a horizontal line on that piece of paper with the the leftmost line being kind of birth, and then you can draw wherever you think your age is. And what I have them do is kind of draw different vertical lines for the different accomplishments, the hills in their lives. Then I have them underneath draw vertical lines for the different valleys of their life, and just jot down, a thing that describes that valley, thing that describes those hills. And what we don't recognize is that behind every hill, there's a valley. After every hill, there's a valley. After every valley, there's a hill. And what I have people do is start to reflect on, how did I get from this horrible valley to this amazing hill? And start to kind of recognize what is their preferred resilient strategy. What's the thing that always takes them there, so that they can start using that. Because literally, what we don't repair, right, we repeat. So it's really about thinking about to yourself that if I haven't figured out, oh, this is the way that I get from here to here, then I'm going to continue going through the motions, having the anxiety, the depression, all of the things, and staying in that valley, instead of quickly learning from my past and moving into the way that I can get back to that next hill.
That was amazing. I'm using that with my clients in therapy.
I was just about to say that. I love that.
We talk about resiliency, but we don't really go into depth about it. We just congratulate people for being resilient. We tell them when they're resilient. And I think that I'm wanting to take a step back and let other people identify when they're resilient. And that's pretty much what you're saying here. And also being able to put the words to it is like so powerful. I love that.
Yeah. And I do say, because often we get all the accolades for, being resilient, right? It's like the strong, they replace the strong with resilient. And it's kind of like, yes, thank you. And like, the goal is that that's not all that we're allowed to be. Like being in a space where we don't just have, right? Because that's what people kind of are like, well, she'll get over it. She's good. Like she'll take care of it. I know it's hard, but and I think our goal really is to make sure that we don't have to tolerate being in spaces where all we're allowed to be is resilient. Mm-hmm. So that's like my end goal. That's what I'm pushing for. That's probably why I'm an entrepreneur now, because those spaces were like, whoa, wait a minute. But I think that's really important for us. Recognize the resilience, but make sure you have the ability to be more than that.
Yes. Well, thank you so much for making my Sunday and for joining us today. We really appreciate it. Having this conversation is so important, and we hope you have a good rest of your weekend.
You too. And thank you for what you guys are doing. I follow you on Instagram and really like love kind of the vibe that you all have. So I'm just very excited and happy to be able to be of service to any of the listeners. And you all are awesome. Keep doing what you're doing.
Yes, thank you.
Thank you so much.
All right, y'all. I hope you enjoyed that episode. I think that my takeaway is just gonna be plain and simple. I am hopping my ass on this Health and You app. And I'm also thinking about who is my team when it comes to, when I'm going into the doctor, who is my support. I'm also thinking about like my emergency contacts because usually like I put my parents, but I'm like, that doesn't make sense. They don't live here. So I'm also thinking about who's going to be my emergency contacts and who else can be like of support that makes sense because I think that's something I don't really think about. So that's what I'm thinking. What you thinking, Donika?
I'm thinking I want to most definitely like spread the word of the information that I've heard today. I'm like, I want to talk to like my mom and like my parents and my sister, like everybody around me. Like, I feel like we need to know this information. We need to be able to not only advocate for ourselves, but advocate for our close and loved ones, because obviously nobody else is going to do it. So we got to, which is not a horrible thing, especially when you have the information. So that is my takeaway. I am most definitely about to, talk to some folks and give them the information too.
Yes. So I want to thank y'all for tuning into this week's episode of Black Women Healing Pod, and we hope that you enjoy the rest of your week.